Have you ever felt like the world in front of you blurred into confusion? Recently, a listener told me how signs and people seem to kind of melt together on a busy street. And that got me thinking about visual crowding, especially those with glaucoma. So today we're diving into what happens when your eyes and brain feel overwhelmed. The information shared in this podcast is for educational and informational purposes only and reflects personal experiences and perspectives. It is not intended as medical advice, diagnosis, or treatment. Always consult with your ophthalmologist, physician, or qualified healthcare professional regarding any questions you may have about your eye health or medical condition. Never disregard professional medical advice or delay seeking care because of something you heard on this podcast. Hello, everyone, and welcome back to Field of Vision. I am so glad that you are here. I'm Nikki D. And as someone living with glaucoma and a former glaucoma surgery tech, I'm here to shine a bit of light on the unseen. We explore new perspectives on life with glaucoma and vision challenges, helping you see more clearly in every sense. What is visual crowding? Let's dive right into it. So, the clinical definition of visual crowding is a perceptual phenomenon in which the recognition or identification of a visual target becomes impaired when it's surrounded by nearby objects, even though the target itself remains visible. A limitation of object recognition caused by nearby visual clutter where the presence of surrounding stimuli interferes with the brain's ability to identify a target stimulus. So that's kind of the clinical definition for it. So here's some key clinical characteristics. So the target, the thing that you're looking at, can be seen, but it cannot be correctly identified. So what you're looking at, you can see something, but you're not quite sure what it is. This effect occurs when objects are too close together in the visual field. So maybe you're at a desk, then it's filled with a bunch of things, and you're asked to find a set of keys, and you just simply cannot find them because there's just too much stuff on that desk. It's strongest in the peripheral vision. So remember, the peripheral vision is that side vision in people with normal vision. So normal vision people do get this, but it becomes more pronounced and it can shift towards central vision in certain eye and neurological conditions like glaucoma. So in glaucoma, visual crowding can occur because the peripheral retinal ganglion cells are damaged. The brain receives less spatial information about the object boundaries, and the visual cortex has more difficulty separating objects that are close together. So basically, everything gets confused. This means patients may report difficulty reading when the text is tightly spaced, trouble finding objects on cluttered surfaces. Remember that little sample I told you about by having a cluttered desk and trying to find your keys and you just cannot find them. Difficulty recognizing faces in groups and feeling visually overwhelmed in busy environments. So I don't know about you, but this happens to me a lot. Sometimes I just get overwhelmed if there's just too much in my environment. Visual crowding means that when objects are close together, your brain sees them as just a big jumble. Normally, peripheral vision helps separate shapes, giving context. But with glaucoma, that peripheral input fades, leaving fewer cues for the brain to decipher. So letters in a word or faces in a crowd seem to overlap. It's not that your eyes aren't trying, it's that your brain's sorting ability is just overwhelmed. Crowding happens to everyone in their far peripheral, so even people with normal vision. But in glaucoma, that crowding shifts closer to the center. So, why does crowding happen? Normally, our brain separates objects, like picking out a single voice in a noisy room. But when peripheral vision is reduced, as in glaucoma, the brain loses those extra cues. It struggles to know where one object ends and the other begins. For everyone, crowding happens in the far edges of vision. But for someone with glaucoma, that confusion can creep into central vision. In other words, the brain misjudges spacing, making objects just blur together. So it can be really confusing. So, how can we manage visual crowding? First, think about contrast. Make what you want to see stand out. So, think about like black on white, bold colors. So, if you're using a computer or an iPhone, a tablet, something like that, think of black on white or white on black, just for things to stand out, or using bold colors. Second, take your time. Give yourself some grace. Take your time. Don't get frustrated. Give your eyes a moment to focus on one thing and just simplify. Try to reduce distractions. If you know that you're going to have to find your keys, try not to throw them on a table with a lot of other things on them so that it can make it easier for you to get them. So, if needed, there are low vision specialists who offer training and tools like magnifiers or apps that enhance contrast. I highly recommend a low vision specialist that can really help you out and it really can change your life. Another technique to try is using structured scanning, which means intentionally moving your eyes line by line or object by object so that you can take your time looking through things. Another tip is to increase lighting. So, well lit environments reduce confusion. And I don't know about you, but when things are not well lit, I cannot see anything. You can also practice focusing on a single stable object before shifting to the next. So, if you are looking for your keys on that crowded table, look at one thing first, move on to the next, move on to the next. And tools like electronic magnifiers or screen readers that can also reduce the need to rely on crowded details, those can really help. Small adjustments can really give your brain the breathing room it needs. Remember, small adjustments can make a huge difference. So, there are a few resources that you can check out that can help you with visual impairment. The American Foundation for the Blind is a great resource. The National Federation for the Blind. Also, there's state-based services for visually impaired. And many hospitals also have low vision clinics. And also, the American Academy of Ophthalmology can help you find a specialist or simply just talk to your doctor and they can help you. There's also a Facebook page called Low Vision and Assistive Tech Support. This is a great place where people dealing with vision challenges, not just glaucoma, but any kind of vision challenges, can share tips and tricks or ask questions, including those related to visual crowding. It's community oriented, so you might find it helpful to connect there. And remember, part of the journey of glaucoma is knowing that you're not alone. By tuning in even to this podcast, you're already part of a community that's exploring these challenges together. Each episode will unpack insights, share experiences, and offer tips. So just by listening, you're taking steps toward clarity, one conversation at a time. I've actually heard from others who've faced this problem with crowding, and one listener shared how adjusting her kitchen lighting helped her read her recipes again. It was really helpful. And another listener wrote in to me describing how using bold labels at work actually helped to reduce confusion. So, by sharing these stories, we realize it's a journey many of us walk, and we can learn from each other's strategies. So, if you have any strategies that you would like to share, please go ahead and submit them in to us. You can find us on our Facebook page, which is Field of Vision with Nikki D, and put a comment on there. You can send me a message there as well. Or you could actually email us at fieldofvision69@gmail.com. That's fieldofvision69@gmail.com. So, as we close, remember small changes and supportive communities can make a huge difference. Whether you're using contrast, seeking a specialist, or just listening in, you're taking steps forward. And if you've got stories or questions, send them in. We are in this together. So, don't forget to email at fieldofvision69@gmail.com or find us on Facebook at Field of Vision with Nikki D. So, if you found this episode helpful, please like, share, and subscribe so that you don't miss a thing. And leave a comment, ask a question. I would love to answer some of your questions here on our podcast. So, I look forward to you joining me on our next episode, and we'll talk soon.